Hello, everyone. Welcome to Kellye Knows Nursing, where I'm Kellye and I know nursing. So, I kind of wanted to come on today to reintroduce my platform, reintroduce my page where I talk all things nursing. Every now and then, I may come on and talk about something that helped me in nursing or talk about an event that's related to nursing. But I just kind of wanted to start live streams to kind of have my communities come on. If you all have any questions, any comments, you can come on my YouTube page. So I've had YouTube for a while, but I never really focused a lot on doing live streamings or just promoting it. So now, since I'm going to promote my courses to help with my students in NCLEX, I decided to go ahead and redo my YouTube platform as well. So I did not invite anyone to my YouTube live today. I just kind of came on in the midst of me studying. So a little bit about me and a little bit about my page. I'm Kellye. I have been a nurse for about 10 years as a registered nurse, and I'm currently going back to school for my nursing educator degree, which is a master's degree program. I attend WGU online. So a lot of my content you will be seeing me talk about school, seeing me talk about study habits. I really like to refer to happy calendars. You'll see my happy planners, calendars. I do a lot of planning and I kind of help others plan as well. So I wanted to help student nurses become nurses and help them understand that passing the NCLEX is very important, but it's a way to prepare and pass this NCLEX. The NCLEX is a standardized test to help student nurses basically become licensed to be a nurse. So there are not enough nursing platforms or it's not enough things to help prepare nurses to become a nurse, helping with the NCLEX, for example. So when I took the NCLEX, I didn't use any outside sources but Kaplan reviews. I used Kaplan books, Lippincott, Saunders, and I just basically sat down and studied and then took the NCLEX. At my school, once I finished my program to become a nurse, I graduated, and then they set up some Kaplan instructors. One instructor, she came in for 1 week, and every day from like 8 to 4, she would come in and talk to us a little bit about test taking skills, a little bit about questions, how to do practice questions to get prepared for the NCLEX. And at the time, the NCLEX was like a 4-hour exam. You can have anywhere between 75 questions to 265 questions. And as you're going through the questions, it will shut off once you deem competent to being a safe and effective nurse. So now, years later, the NCLEX has lesser questions, but next year, April 1st, 2023, they're going to bring the new generation NCLEX out. And so this new generation NCLEX is going to have more select all that apply questions. It's going to have a lot of different content as far as dragging and dropping. You're going to be able to go into different areas of the test, and it's not strictly going to be a multiple test anymore. It's going to be more critical thinking. It's going to be more scenarios. You as a nurse have to prepare yourself not to memorize content, and it's set up for there to be more critical thinking in the nursing environment, because right now after the pandemic they have been so many schools, facilities pushing for nurses to be nursing. Some nurses are just going through the programs just like that. They're having pop-up programs, and nurses are not really using their critical thinking skills to taking care of patients. And now patient populations are getting sicker, the acuity is getting higher, and we need a lot of nurses to use their critical thinking skills and really take care of patients, because you have to think it could be you one day in the hospital and you need a strong nurse to take care of you and put pieces together to help the doctors in diagnosing you, getting you well, educating you, taking care of you, catching critical things before it even happens to you. We need more stronger nurses. So what better way than to make this test harder in becoming a nurse? So I understand the concepts behind it, but I want to help bring a solution to the problem. So I kind of see a solution, which is me being an NCLEX coach firsthand. I have experience. I've been in the work field for 10 plus years. I've taken the stair steps in becoming a nurse. I feel like I've been a CNA for 8 years. I've been an LPN. I've been an ADN nurse, BSN nurse, and now working on my MSN. So I work at every single level there is to become a nurse and be at the top. So that's why I strongly feel just having help with the NCLEX is really, really important. And this is what I come to do. So I'm going to drop a link in my YouTube. It's going to be a link for my nursing page. You go to www.kellyknowsnursing, and then you will go into the services and look at the different services that I provide. I'm going to provide 4 different services. One of the services is going to be starting next week. Actually, I want to accept some students, and my slots are open for 10 slots. I will have 10 students or more. It's from 10 to 15. So if you feel like this program is for you, I want you to apply. I'm going to have spots open for nursing students in their senior and junior year if you want to get a head start on studying for NCLEX. So this is where I'm going to come in. I'm going to have my payment options there. And if you feel like you want to try my program, I'm telling you all, I'm different in the fact that I'm going to provide real life scenarios because I work at the bedside now, and I'm also a unit nurse educator at my job. And I have student nurses all the time. I precept and I'm a mentor. So I want to use those examples in helping you understand practice questions. I want to help nurses become nurses and competent and safe nurses. So you look at the program you want. The first option is if you want to attend a nursing community, I'm going to have Zooms every week. I'm going to meet once a week. Preferably right now, I have it set for Wednesdays to meet from 3 to 5 on Zoom. Once you pay for the program that you want, I will come on in a live setting just like this on Zoom. We're going to go through content and we're going to cover all areas of the NCLEX. I'm going to do 1 month worth of sessions. So every Wednesday we will meet for 2 hours, and I will come on live, talk to you all about strategies, your mindset, some information about the NCLEX, and we're going to do practice questions and everything. And I'm going to do that for 4 weeks during the month of December. And then January, I will have another cohort. I will accept students, and then I will start maybe on another day for 2 hours. And it's going to be you're going to have set schedules with me. You're going to have access to my community, access to my platform. I'm going to be doing things on Instagram as well. I'll come on live with different nurses and kind of talk about test taking strategies and all the above, just to be a community and just to be of help to inspire and motivate my future nurses. So that's something that I want to do. And then next time I come on YouTube, I will make a post. I will set up dates and times where I come in. I will have live chats. But today I just kind of wanted to come on and see how the features are, how it works before I actually go live with a lot of people watching me. So this is kind of like an introductory live YouTube and my personal page, personal platform. So that's one service. And the next service I have is for students. If you don't like a community, if you don't like to do Zooms, you want me one-on-one, I will have a service where we would meet online for 10 sessions. If you're in the Georgia area, preferably a 25 to 30 mile radius from me, and we'll talk about all of that offsite, then I will be able to meet at a local location and meet you for 10 weeks. We'll be able to go through practice questions, go through strategies, help you become a better test taker, and help you be a stronger person in taking this NCLEX. The next option I have is just if you need me, not for NCLEX, but maybe for questions as a nursing student, for assignment questions. If you need help with care plans, I can kind of do that on a one-on-one basis, and that service is a different charge. Also, if you need me for resumes or just kind of helping you cater your resume to a certain particular job, I'll be able to do that as well. So I have a couple services on board set up at my website, and then I will also drop the link to be able to sign up for my NCLEX services. So that's something new. I'm excited about it. I'm excited about seeing you all just join my platform and share, follow, and like. Please subscribe to my channel, and I will be doing more of these, showing up for you all and helping out my fellow nurses and my nursing students in this community. So thank you all. Have a great, blessed Thursday. It's December the 1st. Thursday, new month, new mindset, new ways of thinking and positive affirmations, I'm all for it. Thank you all. Have a blessed day.